Hi, my name is Tasha, and I'm a manual therapy advocate. During this video, we'll explore manual lymphatic drainage, a gentle technique designed to support your lymphatic system. We'll dive into its benefits, who it's for, and important safety considerations. So, what is MLD? Manual lymphatic drainage, also known as MLD, is a light, rhythmic skin stretching technique originally developed by Emil and Estrid Botter in the 1930s. The goal is to enhance lymphatic flow, so to help move the excess fluid and metabolic waste towards the lymph nodes where it's filtered and returned to the bloodstream. So most of the lymphatic fluid drains on the left thoracic duct. You got the right supraclavicular duct, but this is the main one on the left side since this is where your heart is located. So this drains both your legs, your abdomen, and your left arm. The other side, the 25% of your body and your right arm. So around your liver area and up. So the how it works is that MLD uses gentle strokes, and you could also use techniques such as diaphragmatic breathing while um, getting them. It's like a massage, but it's not exactly a massage because it's not as hard as a massage. It's a little softer. You can't be pressing down too hard because the lymph nodes are right under the skin. So as the technician is doing, basically we'll be moving fluid towards the heart, down the neck. If you see the puffiness right here, some people have collection of fluid in the neck. So there's specific uh, techniques on how, like which node to drain into. But essentially, everything is going to be drained into here. And most of the lymph nodes are located in the abdomen. So that's why the diaphragmatic breathing, and the technician will press down as as you're breathing, extending, and then she'll press. And as she presses, all that fluid moves up towards the heart where it's supposed to. So it's meant to enhance lymph flow and help remove excess fluid and metabolic waste, as I mentioned. Um, but it's also for people with chronic conditions like lymphedema. Uh, and people with lymphedema are usually people with cancer, or they've had some skin trauma, maybe removal of lymph nodes, or tumors, occluding the no, the fluid movement. To say you had a tumor in your neck, then your abdomen starts to swell, or parts of your face starts to swell because there's a tumor that's not allowing the lymph to flow. So this is why the technician will have to manually do it, because the lymph system does not move by itself. It doesn't move like your circulatory system, by itself. You have to move it, movement, just muscle movement. So that's how the lymph system works. So the key benefits is to reduce swelling, which is widely used, as I mentioned, lymphedema, especially in post breast cancer treatments. Women might get a swollen arm after a removal of lymph nodes in the armpit, or the breast, a removal, the mastectomy. So it is used combined with compression and exercise, as I mentioned. In order for you to move, your lymph has to move. If you're stagnant, then you end up, the swelling gets worse. So after the manual lymph drainage, the you know the your swelling reduces, but then it'll come back. So that's the point of the compression, so that it prevents from all that work that the tech just did, just to undo itself. Because there is no, once you have lymphedema, I mean, people without lymphedema could do it, but people with lymphedema do necessarily need compression, which lowers limb volume. It also has benefits for pain and stiffness. Paired along with exercise, it could reduce pain and stiffness, as mentioned, and benefiting after post surgery recovery, such as rheumatoid arthritis, fibromyalgia. So, fibromyalgia, if you press too hard, people have a lot of pain. So, it's a very light stretching of the skin. It improves your circulation and your immunity, as your lymph system is part of your lymphatic, your immune system. It also boosts venous and blood flow, and it lessens chronic inflammation because obviously your lymph system is your detox organ. So if it's all stagnant and sluggish, nothing is moving out of your body. It's your garbage disposal. So there's also cosmetic and well-being effects. People do use it. Like I mentioned, I have some puffiness on my neck, and people use it for to depuff their eyes, because that's doesn't necessarily mean you have a chronic condition, but you could get puffy due to dehydration. It is it's indicated for lymphedema, for chronic venous insufficiency patients, lipedema, fibromyalgia, and similar conditions. This, if you're healthy, the effects are usually limited to relaxation and minor hydration shifts, as I mentioned, but it's more widely used for people with chronic conditions. So there is risk and contraindications. So generally safe. It should be avoided um, with people who have blood clots, as you could dislodge the blood clots. People with active infection or cellulitis, which is common with people with lymphedema. You could spread the infection if you're massaging the area that's red. Heart failure or kidney disease, because it could overload the heart with extra fluid as everything drains on the left side. And imagine all that fluid going into the heart when the heart's already stressed. Uh, Also, recent stroke uh, um, victims due to their fragility and circulation, or if there is damaged skin after cancer radiation. But if it is needed for severe lymphedema cases, then it could be cleared by the oncologist. Side effects may include fatigue, headache, nausea, flu-like symptoms, because you are detoxing, which is normal. So they recommend that you drink a lot of water after the fact. But before you decide to do manual lymph drainage, you could go to a place and pay for it, or the insurance could cover it if you have a health condition. Can you could work with a certified lymphedema therapist as they go to medical school for this. And once you're cleared, you can be part of the complete decongestive therapy if you have a chronic condition. If not, like I said, if you have some puffiness around the face or abdomen, it could work for cosmetic reasons as well. So you could also do it at home. uh, you use gentle strokes towards the heart, as I mentioned. No oils, because your skin needs to have some friction. There are videos on YouTube on how to manual lymph drainage, and there's each video for each body part. So, in summary, manual lymphatic drainage offers relief of pain, better circulation, relaxation. It's not a cure all. As I mentioned, once you have lymphedema, you have it for life. But it is meant to reduce the limb and the pain associated with swelling, and also to look pretty, as I mentioned. It is the safest and most effective for those with lymphatic issues if done under professional guidance with a therapist that's certified. Thanks for watching, and feel free to ask any questions and share your experiences. Thank you.